Diabetes Connections is brought to you by Dario Health. Manage your blood glucose levels, increase your possibilities. By Gvoke HypoPen, the first pre-mixed auto-injector for very low blood sugar. And by Dexcom. Take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Simms.
This week, Dexcom announced a big new agreement with Garmin this month. Seemed like a good time to check in on a few issues, including what happens to the watches and insulin pump systems that work with G6 when Dexcom G7 hits the market.
We're already working with Tandem and Insulet on integrating G7 with their products. I've already seen prototypes up and running. They're moving as quickly as possible.
That's Chief Technology Officer Jake Leach, who reminds us that the G7 has not yet been submitted to the US FDA. He answers lots of your questions on everything from G7 features to watch compatibility to the future and possible non-invasive monitoring. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. Always so glad to have you here. I am your host, Stacey Simms, and we aim to educate and inspire about diabetes with a focus on people who use insulin. You know, my son, Benny, was diagnosed with type 1 right before he turned 2. My husband lives with type 2 diabetes. I don't have diabetes. I have a background in broadcasting, and that is how you get the podcast. And when I saw the news about Garmin and Dexcom, I knew you'd have some questions, and I thought, this would be a good chance to talk about some of the more technical issues that we're all thinking about around Dexcom these days. I should note that since I did this interview with CTO Jake Leach on October 19th, and that's exactly 1 week before this episode is being released, that Dexcom released some new features for its Follow app. I did cover that in my In the News segment. That was this past week. You can find the link in the show notes. And as I see it for that news, that release and the update, the big news there is that now there is a widget or quick glance on the follower's home screen. It depends on your device, Apple or Android. There's now tech support right from the Follow app and a way to check the status of the servers as well. And I think that last one should really be an opt-in push notification. If the servers are down, you should tell me, right? I shouldn't have to wonder, are the servers down, and then go look. But that is the update for now. And again, that came out after this interview, so I will have to ask those questions next time. And the usual disclaimer, Dexcom, as you've already heard, is a sponsor of the show, but they only pay for the commercial you will hear later on, not for any of the content you hear outside of the ad. I love having them as a sponsor because I love that Benny uses the product. I mean, we've used Dexcom since he was 9 years old, but that doesn't mean I don't have questions for them. And I do give them credit for coming on and answering them. Not everybody does that. I should also add that this interview is a video interview. We recorded the Zoom on-screen stuff. You can see that at our YouTube channel. I'll link that up in the show notes if you would rather watch. And there always will be a transcript these days in the show notes. So lots of options for however it suits you best. I'm here to serve. Let me know if there's a better way for me to get this show to you. But right now we got video, audio, and transcript. All right, Jake Leach in just a moment. But first, Diabetes Connections is brought to you by Dario Health. And, one of the things that makes diabetes management difficult for us that really annoys me and Benny, it's not really the big picture stuff. It's all the little tasks that add up. Are you sick of running out of strips? Do you need some direction or encouragement going forward with your diabetes management? Would visibility into your trends help you on your wellness journey? The Dario Diabetes Success Plan offers all of that and more. You don't have to wait in line at the pharmacy. You're not searching online for answers. You don't have to wonder about how you're doing with your blood sugar levels. Find out more. Go to mydario.com/diabetes-connections. Jake Leach, Chief Technology Officer for Dexcom. Thanks so much for joining me. How are you doing?
I'm doing great, Stacey. It's a pleasure to be here.
We really appreciate it. And we are doing this on video as well as audio recording as well. So if we refer to seeing things, I don't think we're sharing screens or showing product, but of course, we'll let everybody know if there's anything that you need to watch or share photos of. But let me just jump in and start with the latest news, which was all about Garmin. Can you share a little bit about the partnership with Garmin, what this means, what people can see, what's different?
Yeah, certainly. So I'm really excited to launch the partnership with Garmin. So last week, we released functionality on the Dexcom side, and Garmin released on their products the ability to have real-time CGM readings displayed on a whole multitude of Garmin devices, bike computers, and a whole host of their watches. So they've got a lot of different types of watches for athletics and different things. And so you can now get real-time CGM displayed on that watch. So they're the first partner to take advantage of some new technology that we got FDA approved earlier in the year, which is our real-time cloud API. So that's a way for companies like Garmin to develop a product that can connect up to users' data through the Dexcom Secure Cloud and have real-time data. We've had the capability to do that with retrospective data, the 3-hour delayed. Many partners have taken advantage of that, but we just got the real-time system approved. And so Garmin's the first to launch with it.
Let me back up for just a second. For those who may use these devices but aren't as technologically focused, what is an API? When you got approval for that earlier in the summer for real-time API, what does that mean?
Yeah, so it's API is an application programming interface. And so what it really means is it's a way for software applications like a mobile app on your phone to connect via the internet to our cloud with a very secure authentication and pull your CGM data in real time from our cloud. And so it's basically a toolkit that we provide to developers of software to be able to link their application to the Dexcom application. And really on the user side, to take advantage of the feature, you basically enter in your Dexcom credentials, your Dexcom username and password, and that is how we securely authenticate. And that's how you're basically giving access to, say, for example, Garmin, to pull the data and put it down onto your devices.
What other apps or companies are in the pipeline for this? Can you share in addition to Garmin? I think I had seen Livongo, or are there others?
Yeah, so Livongo, so Teladoc, we purchased the Livongo technology. They've got a system. They're also in the pipeline for pulling in real-time CGM data into their application. And so they're all about remote care. And so trying to connect people with physicians through technology. And so having real-time CGM readings in that type of environment is a really nice use case for them, and for the customers. And so that's where they're headed with it. And we've got kind of a bunch more partners that are in discussions and in development that we haven't announced yet. But we really see the cloud APIs, our interfaces, as a way to expand the ecosystem around Dexcom CGM. So we really like to provide our users with choice. So how do you want your data displayed? Where do you want it? And so, you want it at the right place, right time. For myself, I have a Garmin bike computer, so I can see CGM readings right on my handlebars. I don't have to, look down at a watch or even pull up my phone. So it's really convenient. That's what we're about is providing the opportunity for others to amplify the value of CGM.
This was a question that I got from a listener. What happens to the data? Is that a decision up to a company like Garmin, or is that part of your agreement? Everybody's always worried about data privacy, and with good reason.
Yeah, data privacy is a super important area when you're handling customer information. And so the way that it works is when you're using our applications at the beginning, when you sign up, there's some consents. You're basically saying, this is what can be done with my data. And the way we design our systems is, for example, with the connection to the Garmin devices, the only way they can access your data is if you type in your credentials into there. It's almost like typing your username and password into the web to be able to access your bank account. It's the same thing. You're granting access to your data, and each company has their own consents around data. And so we all are required by regulatory agencies to stay compliant with all the different rules. At Dexcom, we take it very seriously and are very transparent about what happens with the data. And we keep it in all of our consent forms that you click into as you work through the app.
But to be clear, to use the API or to get the Dexcom numbers on your Garmin, you said earlier, you have to enter your credentials.
You have to. Yeah, you have to enter your Dexcom username and password. And that's how we know that it's okay for us to share that information with Garmin's system, because you were the one who authorized it.
Right, but that's also how they're going to use you just said you have to enter your name and password for them to use the information. So they just have to read individually, like, okay, Garmin or Livongo or whomever.
Yes.
I have to read their individual terms of services.
Yeah. For each application that you want to use, it's important to read what they do with the data and how they use it.
That's really interesting. And has anything changed with Dexcom? It's been a long time since we've talked about how you all use the data. My understanding is that it was blinded. You're not turning over to health insurers and saying, Stacey's son on this day ate this, or are you?
No, not at all. We basically use the information to track our product performance. So we look at how products are, so it's de-identified. We don't know whose product it was, but we just can tell how products are performing in the field. That's a really important aspect. We also use it to improve our products. So when we see the issues that are occurring with the use of the product, we use it to improve it. So that's our main focus. And the most important thing we do with it is provide it to users where and when they need it. So follow, remote monitoring. That the reason we built our data infrastructure was to provide users with features like follow and the Clarity app and so forth.
Do those features work on other systems? Can I use Garmin to share or follow?
Not today. So right now, it's basically intended for the person who's wearing the CGM. It's your personal CGM credentials that you type in to link the Garmin account. And so for today, it's specific around the user.
I assume that means you're working on for tomorrow.
There's lots of opportunities.
Which leads us, of course, to, well, I don't have to worry about that right now because you can't use any of this without the phone. And the phone is how we could share and follow. So it's not really an issue yet. Jake, talk to me about direct to watch to any of these watches. Where do we stand? I know G6, it's not going to happen. Where are we with G7 and that? Right back to Jake answering my question. You knew I was going to bring that up. But first, Diabetes Connections is brought to you by Gvoke HypoPen. And when you have diabetes and use insulin, low blood sugar can happen when you don't expect it. That's why most of us carry fast-acting sugar. And in the case of very low blood sugar, why we carry emergency glucagon. There's a new option called Gvoke HypoPen, the first auto-injector to treat very low blood sugar. Gvoke HypoPen is pre-mixed and ready to go with no visible needle. In usability studies, 99% of people were able to give Gvoke correctly. Find out more, go to diabetes-connections.com and click on the Gvoke logo. Gvoke shouldn't be used in patients with pheochromocytoma or insulinoma. Visit gvokeglucagon.com/risk. Now back to Dexcom's Jake Leach answering my question about direct to watch.
Yeah, Stacey, that's a great question and a really exciting technology. So direct to watch is where through Bluetooth, the CGM wearable communicates directly to a display device like a watch. So today, G6 communicates to the phone and to insulin pumps in our receiver are the displays. With G7, what we've done is we've re-architected the Bluetooth interface to be able to also, in addition to communicating with an insulin pump or a receiver and your mobile phone, it can also communicate with a wearable device like a Apple Watch in particular, but other watches have those capabilities. With G7, we're introducing the capability within the hardware to have the direct communication, direct to watch. And then in a subsequent release soon after the commercial launches of G7, we'll have a release where we bring the direct to watch functionality to the customers. There's the Bluetooth aspect, which is really important. You got to make sure it doesn't impact battery life and all those things. But there's also the aspect of when it is direct to watch, it becomes your primary display. And so being able to reliably receive alerts on the watch was something that initially in the architecture wasn't possible. But as Apple's come out with multiple versions of the OS for the watch, they've introduced capability for us so that we can ensure you get your alerts when you're wearing the watch. And so that was a really important aspect for us, and it's also for the FDA to ensure that if that's your main display, you've walked away from your phone, you have no other device to alert you, that it's going to be reliable. And so that's exciting progress over the last couple of years with Apple, making sure that can happen.
We're all excited for direct to watch. Obviously, it's a feature that many people are really clamoring for. But you guys promised it first with the G5 in 2017. Do you all kind of regret putting the cart before the horse that way? Because my follow-up question is, why should we believe you now?
Yeah, Stacey, is a good question. So our hand was kind of forced because Apple actually announced it before we did. So they basically said, we're opening up this capability on the watch to have the direct Bluetooth connectivity. And of course, we were excited to have someone like Apple talking about CGM on that kind of a stage. But then as we got into the details of actually making it work, we continually ran into another technical challenge after another technical challenge. And I totally agree. I wish it would have been 2 years later that they talked about it at the keynote. But I'm comfortable that we've gotten past those types of issues. And it is built into G7. So we've got working systems. And so it will introduce it rather quickly with G7.
And to confirm, G7 has been submitted for the CE mark, the approval in Europe, but has not yet, as you and I are speaking today, has not yet been submitted for FDA approval in the US.
Yeah, we're just finishing up our submission. We got some validations that we're running on some of the new manufacturing lines to make sure we can build enough of these for all the customers. We want folks to move over to G7 as quick as possible. And so we'll submit G7 to the FDA before the end of this year.
Just kind of building off what you mentioned about Apple making these announcements, or, sometimes Apple lets news get out there because I don't know if they seem to enjoy it. I mean, I'm speculating. I don't have any inside track at Apple. But I wanted to ask you, I don't know if you can say anything about this. For the last year, every time I talk to somebody who's not in the diabetes community, but they're on a technology podcast or they're hearing things about non-invasive blood glucose monitoring, right? The Apple Series 7 or some watch this year was supposed to have this incredible non-invasive glucose monitoring. It was going to put Dexcom and Libre out of business. It was going to be amazing. Of course, it didn't happen, but a bunch of companies are working on this. And Apple seems to be really happy to say, maybe, or we're working on it too. Is Dexcom listening to these things? I mean, obviously they're not here yet. They are going to come. I'm curious if this is all you kind of happy to let that lay out there as speculation, or if you guys are thinking about anything like this in the future.
We pay a lot of attention to non-invasive technologies. We have an investment component of our company that looks at early stage startups. We also have many partnership discussions around CGM technologies. And so when it comes to non-invasive, I think we'd all love to have non-invasive sensors that are accurate and reliable. For many, many years since I've been working on CGM and many years before that, there has been attempts to make non-invasive technologies work. The challenge, though, is it's just sensing glucose in the human body with a non-invasive technology is not been proven feasible. It's just there's a lot of different attempts and technologies that have tried, and we pay close attention because if something started to show promise, we would become very interested in it and basically making a Dexcom product that uses it. We just haven't seen anything that is accurate and reliable enough for what our customers need. That's to say there could be a use case where a non-invasive sensor doesn't have to be as accurate and reliable as what Dexcom does. And so maybe there is a product there, but we're very focused on ensuring that the numbers that we show, the glucose readings that we present to users are highly accurate and highly reliable, that you can trust them. And so when it comes to non-invasive, we just haven't seen a technology that can do that. But I know that there's lots of folks out there working on it, and we stay very close to the community.
Yeah. One of the examples I gave a guy who does an Apple technology podcast, and he was like, well, what do you think? And I said, well, here's an example. If you had a scale and you have no idea if it's accurate, but you know that once you step on it, that number probably is stable. Then okay, I gained 10 pounds, I lost 10 pounds, but I have no idea if that beginning number makes any sense at all. You might be able to use it if you are a pre-diabetic or if you're worried about blood glucose, but you could never dose insulin using it because you have no idea where you're starting. So I think that's, my layperson speculation, I think that's where that technology is now. And to that point, what other people outside the diabetes community are looking to, one of the more interesting stories, I think, of the last year or two has been use of CGM and flash glucose monitoring for people without diabetes at all, for athletes, for people who are super excited and interested in seeing what their body is doing. So we have companies like Levels and Super Sapien and that kind of thing using the Libre. I'm curious of a couple of parts of this question, if you think you want to answer it. Is Dexcom considering any of those partnerships with the G7, which is much more simple, right? Fewer parts and that kind of thing.
Yeah, that's a great point, Stacey. So yes, G7 is a lot simpler. It was designed to be to take the CGM experience to the next level. And part of that is just the ease of use, the product deployment, the simplicity. Someone who's never seen a CGM before, we want to be able to walk up, approach G7 and just use it. There's a lot of opportunity, we feel, for glucose sensing outside of diabetes. Today, CGMs are indicated for use in diabetes, but in the future, with 30% of the adult population in the US having prediabetes, meaning the glucose levels are elevated, but not to the point where they've been diagnosed with diabetes, there's just so much opportunity to help people understand their blood sugar and how it impacts lifestyle choices, impact their blood sugar. And the immediate feedback you get from a CGM is just, there's nothing else like it. And so I think, prediabetes, and even as you mentioned, kind of in athletics, there's a lot of research going on right now in endurance athletes and in weight loss around using CGM readings for those different aspects. So I think there's a lot of opportunity. Today we're focused on diabetes, both type 1 and type 2, and really getting the technology to people around the globe that can benefit from it. That's where our focus is, but we very much have programs where we look at, okay, where else could we use CGM? It's such a powerful tool. You could think in the hospital, there's so much opportunity around glucose.
All right, so I'm going to give you my idea that I've given to the levels people, and they liked it, but then they dropped off the face of the earth. So I'll be contacting them again. Here's my idea. If somebody wants to pay for a CGM and they don't have diabetes, but they're like paying out of pocket because they like their sleep tracker and they like this and they like that, or some big company's going to buy it and give it away for weight loss or whatever. You know, the shoe company Tom's, where you buy a pair of shoes and they give one away. People are in the diabetes community are scrimping and saving and doing everything they can to get a CGM. Maybe we could do a program like that, where if you don't, quote unquote, medically need a CGM, your purchase could also help purchase one for an underserved clinic that serves people with diabetes.
Getting CGMs to those folks that need them, particularly in underserved areas, clinics, it's so important. I like the idea. That is an option. If there was a cash pay component that then provided CGMs to those that are less fortunate, I think I like the idea. Next month is National Diabetes Awareness Month, and one of the things we're focused on for the month of November is how can we bring broader access to CGM? It's something we've been working on, since we had our first commercial product, and there's still, many people in the United States benefit. 99% of private insurance covers the product. A lot of our customers don't pay anything; they have no copay. But that's not the case for everybody, and so there's definitely areas that we are focusing on with some of our nonprofit partners on bringing that type of greater access to CGM, because it's such a powerful tool in helping live a more normal life.
In the couple of minutes that we have left, I had a couple more questions, mostly about G7, but you mentioned hospital use. And last year, I remember talking to CEO Kevin Sayer about Dexcom's new hospital program, which I believe launched during COVID. Do you have any kind of update on that or how it's been going? Yeah,
so it was an authorization that we got from the FDA to a special case during COVID to be able to use G6 in the hospital. And so we had quite a few hospitals contact us early on in COVID saying, hey, we've got these patients. Many of them have diabetes. They're on steroids. They're in the hospital and we're trying to manage their glucose and we're having a hard time because their standard of care in the hospital is either labs or finger sticks. And so we got this authorization from the FDA. We shipped the product. Many hospitals acquired it and they were using it pretty successfully. What we'd say about, G6 is really designed for personal use. You have your mobile phone or your little receiver device. It's not integrated with a hospital patient monitoring system or anything like that. You could imagine in the future that could be a real strong benefit for CGM in the hospital. You can imagine you put it on, anybody who has glucose control issues comes in the door, and then you basically can help ensure where resources need to be directed based on, glucose risk. I've always been passionate about CGM in the hospital. It was one of the early projects I worked on here at Dexcom. And I think there's a lot of promise, particularly as we've improved the technology. So there's still hospitals today using G6 under the authorization. And we're interested in designing a product for that market specifically instead of, right now it's kind of under emergency use, but we think there's a great need there that CGM could help in basically glucose control in the hospital.
That's interesting too. Of course, my mind being a mom went to camp as well, right? If you could have a bunch of people, I envision like a screen or, hospital monitoring, that kind of thing. You wonder if you could do something at camp where there's 100 kids, instead of having their individual phones or receivers at camp, it would be somewhere central. I don't know.
Well, you know what? With the real-time API, there are folks that are thinking about a camp monitoring system that can basically be deployed at camp. Because right now with Follow, it's great for a family, but it's not really designed to follow a whole camp full of campers. Right. But with the real-time API, there's opportunities for others to develop an application that could be used like that. So yeah, there you go.
All right. A couple of G7 questions. The one I got mostly from listeners was how soon, and I know timelines can be tricky, but how soon will devices that use the G6, will they be able to integrate the G7? Insulin pumps, that sort of thing.
Sure.
It's only Tandem right now, but Omnipod soon, that kind of thing.
Yeah, Omnipod's coming. So I'll start with the digital partners like Garmin and others. That is going to be seamless because the infrastructure that G6 utilizes to move data to through the APIs is the same with G7. So that'll be seamless. When you talk about insulin pumps, so those are the ones that are directly connected to our transmitter. They're taking the glucose readings for automated insulin delivery. So those systems, we're already working with Tandem and Insulet on integrating G7 with their products. I've already seen prototypes up and running. So they're moving as quickly as possible. So once we have G7 approved, then they can go in and go through their regulatory cycle to get G7 approved for use with their AID algorithms. Really, the timing is dictated mainly by those pump partners and the FDA, but we're doing everything we can to support them to ensure that's as quick as possible.
Jake, I should have asked at the beginning. I'm so sorry. Do you live with type 1? I've completely forgotten.
I don't. I made a reference to wearing CGM. I wear them all the time because as kind of leading the R&D team here, I love to experience the products and understand what our users, what their experience is. And I just love learning about my glucose readings in the different activities I do. So I don't have type 1, but I use the products all the time.
Got it. So to that end, have you worn the G7? And I guess I'd love to know a little bit more about ease of use. It just looks like it's so simple.
It is, yeah. So I've participated in a couple clinical trials where we use G7. It is really simple. One of the most exciting things, though, I have to say, is that when you put it on, it has this 30-minute warm-up. So the 2 hours that we've all been used to for so many years, by the time you put the device on and you have it paired to your phone, there's like 24 minutes left before you're getting CGM. So that part is just one of those things that it sounds awesome, but then when you actually experience it, it's pretty amazing. But yeah, the ease of use is great because it's the applicator is simple. It's a push button like G6 where you just press the button and it deploys. But there's other steps where you're not having to remove adhesive, liners. The packaging is very, very small. So we really focused on low environmental footprint. And so it's really straightforward. But probably the really significant simplification of the application process is because the transmitter and the sensor are all one component and sterilized in the same altogether. There's no pieces. There's no assembly required. You basically take the device and apply it, and then it's up and running. There's no transmitter to snap in or two pieces to assemble before you do the insertion.
I think I know the answer to this, but I wanted to ask anyway. Was it when you applied for the CE mark, and I assume this would be the same for the FDA, are there alternate locations? In other words, can we use it on our arms? That is a great question. Yeah, our focus with G7 and the revised form factor, the new smaller form factor and sensor probe, it was arm wear. So yeah, arm wear is a really important part of the G7 product. I got a question about Dexcom One, which seems to be a less expensive product with fewer features that's available in Europe. Is that what Dexcom One is? Yeah, so there's a product that we recently launched in Europe, in European countries. It's called Dexcom One. And what it is it's a product that's designed for a broad segment of diabetes, type 1, type 2. It's a lower price point. It has a reduced feature set from G6, but what it's really about is simplicity. And so it's available through an e-commerce solution. So it's really easy to acquire the product and start using it. It's really to get into certain markets where we either didn't have access to certain customers. And so it was really designed for generating access for large groups of people that didn't have access to CGM before. What does e-commerce solution mean? No doctor? Outside the United States, CGM no prescription required from many, many countries. So the US is one of the countries that does require prescriptions. Some other countries do too, but there's a large group outside the US that don't. But it's really around, you can basically go to the website and you can purchase it over a website. So really kind of nice solution around, think Amazon, right? You're clicking on add the sensors and you're purchasing it. It's an exciting new product for us that we are happy to continue developing. Think it might come to the US? Don't know. Yeah, that's a good question. Don't know. I mean, I think right now we see CGM coverage is so great. Access is great for CGM in the US. It can always be better. We're going to continue to focus on that. But it's really for countries where there wasn't access. I would think tough too, since we do need a prescription. Different model. Yeah. Jake, you have been with Dexcom almost 20 years, 18 years now, and a lot has changed. When you're looking back and looking forward here at Dexcom, I don't really expect you to come up with some words of wisdom off the top of your head, but it's got to be pretty interesting to see the changes that the technology has brought to the diabetes community and how, I don't know, it just seems from where I sit, and you're probably a couple of years ahead, it seems like the last 5 years have just been light speed.
It has been. Things are speeding up in terms of our ability to bring products to market. And there's a lot of things. One is the development of technology. The other component is working with your groups like the FDA on, how do we get products to customers as fast as possible? And that's been a big part of it, right? Moving G6 to class 2, becoming an iCGM, that was a huge part of our ability to get the technology out quickly and also scale it. I think there's a lot of aspects it has been faster. And, when I started at Dexcom, we had this goal of designing a CGM that was reliable, didn't require finger sticks, that you could make treatment decisions off, all that. And we were 100% focused on that. And as we've got closer and closer, and now we have that with G6 and also with G7, then the opportunity that product can provide, you start to really understand how impactful CGM can be around the world. And that's what I'm excited about now. Is I'm still excited about the technology. I always will be. And we still have lots to do on making it better, more reliable, and more integrated. But just how much CGM can do around the globe. There's just so many things, and it's beyond diabetes too. So very excited about the future.
Many thanks as always. And we'll talk soon, I am sure. But I never get to say it enough. I can't imagine doing the teenage years with my son without Dexcom. You guys, I know you did it just for me. You did it just in time. Appreciate it very much. He is doing amazing. And he would not be sticking his fingers 10 times a day. So thank you.
That's great to hear. Thanks, Stacey.
You're listening to Diabetes Connections with Stacey Simms.
As always, more information at diabetes-connections.com. And yeah, about that last bit there, I can say nice things. I really do feel that way, and I can still ask not so nice questions. Look, if you're new, quite often I will open up a thread in our Facebook group. It's Diabetes Connections, the group, to gather questions for our guests. And I did that here with Dexcom. There's usually quite a lot of questions. I do have to apologize. I missed a big one because of the timing of the interview. I promise I will circle back around next time I talk to Dexcom. And that is all about the updates for iOS and for new phones and how, sometimes Dexcom is behind the updates. What I mean by that is that they lag behind the updates. So you can go to the Dexcom website. I'll put a link up for this for Dexcom products that are compatible in terms of which iOS and that kind of thing. And they are behind. And Dexcom will always say, they've said very publicly that they are working hard to catch up. But I guess the question that a few people really wanted to know was why? Why do they lag behind? What can be done about that? So they know, but I think it would be a good question to ask. So Sarah and others, I appreciate you sending that question, and I apologize that I didn't get to it this time around. And I'll tell you, it's not something we've experienced, but I think it has to do, and I'm speculating here, more with the phone, with the newness and the model of the phone sometimes than for the updates, especially if you don't have your updates on automatic. So I guess I'm kind of saying the same thing. But what I mean by that is Benny and I have very old phones. I have an 8. I'm not even sure he has the 8. We are terrible parents, and I don't care about my phone. I would still have a BlackBerry if that were possible. So I can't commiserate. I'm so embarrassed to even tell you that. I can't commiserate with the updates because it's just not something that we have done. Benny definitely, if he were here, trust me, it's like his number. I won't say it's his number 1 complaint, but it's really high up on the list of complaints to the parenting department in our house. And yes, Hanukkah is coming. His birthday is coming. There will be some new phones around here. I'm due for an upgrade, I'm sure. Both of us have cracked phones. We're the worst. Oh my goodness. All right. Well, more to come in just a moment. But first, Diabetes Connections is brought to you by Dexcom. And this is the ad I was talking about earlier in the interest of full disclosure. But one of the most common questions I get is about helping kids become more independent. I get asked this all the time at conferences, for virtual chats in my local group. These transitional times are tricky, and we've gone through this preschool to elementary to middle to high school. I can't speak high school to college yet. But, using the Dexcom really makes a big difference for us. It's not all about share and follow, although that's very, very helpful. Just think about how much easier it is for a middle schooler to look at their Dexcom rather than do 4 to 5 finger sticks at school, or for a second grader to just show their care team the number. Here's where I am right before gym. At one point, Benny was up to 10 finger sticks a day. He didn't have Dexcom until the end of 4th grade. Not having to do that made his management a lot easier for him. It's also a lot easier to spot the trends and use the technology to give your kids more independence. Find out more at diabetes-connections.com and click on the Dexcom logo. I don't know about you, but I am getting a ton of email already about Diabetes Awareness Month, and that is November. This time of year, I usually get, I'd say 1 in 20 emails that are not snake oil, right? 1 in 20 emails that maybe make sense for something we want to talk about on the show here or that I would share on social media. And I'm just inundated with nonsense. So I hope you are not as well. But I got to say, Diabetes Awareness Month this year, I've been polling in my local group and talking about what to do because usually I highlight a lot of people in stories, and I'll still do that, I think. But I got to tell you, people are, you know this, we're all stressed out. And while it's a wonderful thing to educate, I always think Diabetes Awareness Month is not for the diabetes community, right? We are plenty aware of diabetes. This is a chance to educate other people. And that's why I like sharing those pictures and stories on my page, because the families then can share that with their people. And it's about educating people who don't have diabetes. But gosh, I don't know, this year, I'm going to be just concentrating on putting out the best shows that I can. I do have a new project I mentioned last week that we're going to be talking about in the Facebook group. By the time this airs, I will have the webinars scheduled in the Facebook group. So I'm very excited about that. Please check it out. But what are you doing for Diabetes Awareness Month? If you've got something you'd like me to amplify, please let me know. You can email me, Stacey@diabetes-connections.com, or you can direct message me on the social media outlet of your choice. We are at YouTube, Facebook, Twitter, and Instagram. That's where Diabetes Connections lives. I'm not on TikTok or Snapchat or Pinterest. Oh my gosh. All right, well, that will do it for this week. Thanks as always to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I will be back on Wednesday live with In the News, live on Facebook and now on YouTube as well. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.